Good morning, everybody. This is Pauline Chung with the San Mateo Area Chamber of Commerce. I am the Director of Communications and Marketing. And today we have James De La Torre here. He is the President and CEO of De La Torre and Associates Insurance Services, Inc. He will be talking about understanding and maximizing your benefit plan. I ask that you stay muted. Jim has been an insurance broker for 22 years in the Bay Area. So he is very, very well versed about this topic. So I'm going to turn it over to Jim, and I am recording this session. Thank you very much.
Thank you, Pauline, and good morning, everybody. I hope you're all having a good day so far, and wanted to thank you for taking the time to come to the presentation today. Today, we have 30 minutes, and we're going to talk about some of the key elements that are involved in planning a benefit package for you and your employees. And so over the next half hour, we're going to discuss such things as compliance, communication, retention strategies, employee benefit design comparisons, as well as we're going to end with a case study of something that of a client we worked on recently that I think is kind of relevant to the discussion that we're having. Keep in mind, questions are always encouraged. I like the opportunity for people to ask questions. So if you have a question, if you want me to, dive down deeper into something, please feel free to raise your hand and get Pauline's attention, and I'll be more than happy to address those questions. This is really not so much about what I want to talk about as is what's of interest to you. So if I'm not covering something in enough detail, please don't hesitate to stop and ask me. I'd be more than happy to go over that with you. And so what I want to talk about is why companies offer benefits to their employees to begin with. I mean, it certainly isn't because they're looking for ways to throw money away. Employee benefits are important to businesses because they're an investment. They're an investment into the company, they're an investment in their employees, and they can do lots of things to benefit an organization, such as create appeal when attracting employees to come work for them. They can help minimize employee turnover. They can create better morale within the company, and they can also help your employees and their families stay healthier and create better job performance. However, with employee benefits come both internal and external factors that can also influence the benefits that you offer. And when you look at internal factors, what you're really looking at are your workforce demographics. What type of employee are you bringing in? Age, what type of usage are they using within their benefit package? Are they heavy users, or are they people who really don't use their plan designs? Type of workforce you have goes a long way in figuring out the types of plan designs you want to make available to your employees. You also have to consider the external factors that can weigh down on your company. And these things are like competition. What's your competition offering their employees, and how do you stack up to the competition? What about inflation and the economy and where it is today? And of course, we can't forget the impact of what the pandemic is causing both today and into the future, as well as potential other legal requirements that can come in, the taxation, other benefit advantages of bringing in plan designs. So all these come into weigh when you're looking at creating a benefit package for your employee. And what we quickly learned from this is that all benefit packages are different. There's no one size fits all. This works for everybody. And as a result, we always have to be willing to adapt programs to meet the needs of our employees, and to meet the needs that are going to suit us both today. And of course, remembering that what works today may not work tomorrow. So we have to stay on top of it and continue to make changes into the benefit packages to make sure that they stay relevant. Taking care of your employees, and they will take care of your business. It's as simple as that. Quotes from Richard Branson. It really says it all. It says it all in that really what employees want is that they really want to know that their employers appreciate their efforts, and that they are valued. And so making sure that as employers, we take time to let them know we appreciate them is critical in creating longevity of employment with our employees. And these are also reasons why we look to benefits to be able to create this platform that creates value in coming to work for us. And so when we start looking at different key elements of our benefit plans, one of the first things I want to talk about is compliance. So first of all, what you have to realize and what you have to come to terms with is that there's a responsibility we have as employers offering benefits to our employees. Lawmakers at the federal, the state, the local levels all want to have a say in what we do and how we do it. And in a lot of cases, they are not kind to employers who do not follow their laws or who violate their laws with fines and penalties. So it's important that when we take on this responsibility, we make sure that we stay in compliance as things change. Ultimately, it's your responsibility as the employer to stay up to date with compliance issues. And while it's not as easy as it sounds, because there's a lot of information that gets passed along about things that are going on the legislative fronts. And if you're like me, we get inundated with them all the time via email. And the problem is having the bandwidth to be able to search through those emails, search through and research what actually works for me. So sending updates really isn't enough to help you make sure you're in compliance with the state, with all the laws that surround us. What the business owners really need to do is to lean on their brokers to make sure that the information they get from them pertains specifically to their needs, to how it's going to impact their business. You're not interested, if you're in a restaurant business, you're not interested in legislation that's going to impact the trucking industry. You want to know what's going to impact you. And you want to make sure that your broker is providing that information to you so that you stay on top of it. And so with that, you always want to have a compliance strategy that will help you avoid fines, penalties, and most importantly, wasting time chasing down these responsibilities. The next area is employee communication. Let's face it, employees' perceptions are their reality, and how they perceive your benefits goes a long way towards their opinions of those benefits. And let me also add to that for most people in general, anytime they have to read something that's insurance related, it's really like reading a foreign language. People just don't understand it. So let me just ask a question, and this is one that you don't really have to answer, but just think about it to yourselves. How well do you really know the ins and outs of your health insurance plan as it stands today? Okay, and that goes a long way to understanding how our employees perceive things. Employee benefits are a small fortune for us to cover employees. And we need to understand, we need to help them understand how to utilize those benefits. The more they understand how to utilize the benefits, the more they value what you're offering them to keep them employed with you. And it's not just about sending them, this is your plan design, this is your deductible, your coinsurance, this is your doctor list, or this is your dental plan. It's about diving deeper and teaching your employees how to access the plan. How do they get doctors? How do they file claims? How do they see it through when they really don't understand? Okay, so when you look at this benefit package as an investment, you want to come up with an educational platform that is going to teach your employees how to maximize these benefits that are being offered. The more they understand your benefits, the better they're going to be equipped to stay with you as times change or when times change. This leads to employee retention. Employees in many cases are the faces of our business. They're what our customers come in and see on a regular basis. And as a result of that, wanting to make sure that we have a consistent face and an image in front is important. If we're constantly losing employees because they're going elsewhere, they're going to our competition, that has an impact on our business. Not just in the cost to retain or to rehire and to retrain an employee, but more importantly, it also can impact our ability to attract new employees to the companies. Because today there's a lot of resources out there for people who are job hunters, and they get to look more in depth about what your employees think about your company. Being aware of things like Glassdoor and how employees look to programs like Glassdoor to help them is critical in helping them decide where they want to work. So making sure that we communicate well with our benefits helps our employees feel comfortable in staying with us. When you look at plan designs and you look at different impacts, different things that we do to evaluate plans, there are certain things we want to point our attention to. One of them is what is called the out-of-pocket maximum. Now, every medical plan has an out-of-pocket maximum. What that simply means is how much money during the calendar year, which is January 1 through December 31st, does an employee and or their family have to spend out of pocket before the insurance plan covers 100%. Now, the out-of-pocket maximum includes deductibles, co-insurance, and co-pays. So this is the bottom line of what an employee has to spend on an annual basis. And out-of-pocket maximums will vary from plan to plan. You want to make sure you understand what is the out-of-pocket maximum that your employees are going to have to spend when they utilize the plan so that they can certainly take advantage of the, so that they certainly understand what their financial obligation is on an annual basis if it comes to a worst case scenario. The other area is a deductible. Now, deductible for insurance purposes is an amount of money a person has to spend before any involvement with the insurance company. So if you think of your auto insurance plan, if you have a $1,000 deductible plan, you will cover all auto repairs up to $1,000. And then once you reach that $1,000, then the deductible, the insurance company comes in and pays the difference. Okay, and so when you look at deductibles within medical plans, like auto plans, the higher the deductible you go, it translates into lower premium. But just because we move to higher deductibles to do cost transfer, lower premiums, what we find is that not all high deductible plans work the same. So there are some high deductible health plans out there that are what we call qualified high deductible health plans, which means they get certain types of status, tax benefits, and other things that are available to you and your employees that can make them more attractive. And so you want to make sure when you're assessing high deductibles, are there any tax favored abilities, such as a health savings account that you can apply to this to help defer some of the costs to your employees by minimize their taxes. And we'll talk about that in just a few minutes. The next thing we have to look at are networks. Access to healthcare might be the most important and overlooked aspect of employee benefit planning. Okay, there's a number of providers out there. They're large, they're wide range, they cover doctors and hospitals, and insurance companies use these networks as a way to control prices through discounts, and they encourage employees to stay within these networks so that they can minimize their out-of-pocket expense and save money across the board. So networks have become a very vital piece to the insurance planning, employee benefit planning arena. Okay, and so what happens is carriers will sometimes offer reduced plans with a smaller network. In the insurance industry, we call these skinny networks. And what they are is they limit the network and the access points of the employees to thus preserve greater discounts. When you're evaluating your medical plan, you want to determine if there's a limitation on the benefits that there are limitation of access points to the medical plan that you're getting into, or do you have access to the entire medical plan? And if it is limited, then you want to make sure you understand that and you clearly communicate that to your employees, because once again, if they don't understand and they go outside the networks, they could be hit with a substantial amount of dollars that will and could impact them financially. So when you look at this, you got the out-of-pocket maximum, the deductibles, and the network sizes. These are three areas that you want to evaluate during your employee benefit evaluation time so that you can, in fact, make sure that you are taking advantage of costs and maximizing those benefits to your employees. When you look at the life of a life cycle of your medical plan, what you start with is a renewal. And these renewals usually come about 60 days before your benefit year expires. So if your plan renews on July 1st, you might see your renewal coming right at the beginning of May. And in that renewal, it will tell you what increases or if they're canceling or adjustments they're making to the plan. And then you have 60 days to adjust. You have 60 days to make adjustments during that open season period. This is the time where it provides you as the owner the ability to readdress your benefit strategy. What are you looking to accomplish? And are they going to be lined up with the actual benefit plan that you're being renewed with? Is it still consistent? Does it still meet the needs of your employees? And this is when you want to take a look at it. After you go through that assessment, you want to go to market to compare plans. You're doing this maybe not necessarily because you're looking to switch your medical plans, but you're looking to see what else is available, to compare different plans, to make sure that you're getting the best deal for the dollars you're spending, or to see if maybe there's some different plan designs that were not available last year that are available this year that may make more sense for you. Once you decide on what you do, whether it's to re-up with your existing carrier or it's to change to a new carrier, you go through the process of implementing the renewal. You want to monitor and report the successes and failures of your plan. You want to listen to your employees, and you want to look to make and prepare for making adjustments on the next year. Benefit planning is a living, breathing process. Things change, just like in business. As things change, what happens is we need to change with them to make sure that our plans stay relevant, that we are able to stay ahead of the pack with our plan designs. Just because we did something a certain way for the last 10 years doesn't mean it's going to work this year. And so having the willingness to explore will help you maximize this investment and keep your employees in line. And with that, I want to talk about a case study that we did. This is an actual client, although it's not the ABC client, but this is an actual client we worked on. And we thought that this was relative to kind of show you some of the internal ins and outs of how things can happen with the renewal, and how by working, how your broker could or can or should, I should say, be able to walk through and help assess what you're actually looking at. And so this is a company that they renewed on July 1st. So they just renewed, and they received their notification on May 1st. So you have this 60-day window. And again, 60 days is not a lot of time to assess, quote, and go back and re-enroll. So as an employer, when you get your renewal, it's not something you put in a file to do later. It draws your attention. And a lot of it goes back to perception. Don't look at your benefits as a expense. Look at it as an investment. You want to protect this investment. You want to address this situation as soon as possible so that you can find what's best for you. When this renewal came out, what the client found is that the current plan that they were offered, that they were using, was no longer going to be offered. So the insurance company was canceling the plan. Now, for this client, they had gone through a series of years, consecutive years, where the insurance company was no longer renewing their plan, and they were having to change their plan each and every year. And this can be a common occurrence within the ACA, the bronze, silver, gold plans, as carriers change and modify those plans on an ongoing basis. And so the client was getting frustrated because they kept seeing their plan designs being changed, being canceled, and they're offering different options. In the renewal, the carrier offers what they called the closest plan match to what they currently had, based upon what they were offering. And they suggested that this plan would renew at a 1.1% decrease. So when you read the review, when you read the renewal, it's saying, okay, look, your plan's not being offered, but we're going to offer you another plan. This other plan is really close to what you have, but it's really at a 1.1% decrease. A lot of times that's enough for a company to say, you know what, let's move forward with this because I can save money on this and it's close. But what we ended up doing is doing a deeper dive into what they actually had. And what we did is we compared their current plan to the suggested plan that the insurance company was offering. And we did a cost comparison when we annualized the premium rates of these two plans. And what we found in this evaluation was the old plan offered a $750 deductible. The prescription drug benefit was just a copay only, and their out-of-pocket limit was $6,000. And so this is an employer who has a long-standing relationship with their employees, wants to take care of their employees and make sure that their employees have as best a medical plan as possible, because it's important to the employer, and it's what allows the employees, it's their way of keeping their employees and showing appreciation to their employees. Well, the new plan design, the one that they came back with and said was closed, had a $1,500 deductible, which was double. They added a $250 prescription drug program, and the out-of-pocket expense was 6.5%. What we also found was interesting is the way they laid out the premiums was a little confusing, because they upped the age demographic of, they increased the age of all the participants and then ran it against the old number. When you actually did a side-by-side, what did we pay for this plan versus what does this cost this plan, the new plan stack up, it's actually a 2.2% increase, not a 1.1% decrease. So in the deeper dive into this benefit package, what we saw was a higher deductible and a rate increase. And when you look at the $1,500 deductible, you start to enter into the realm of high deductible plan options. And so the employer, who was more benefit conscious, was a little disturbed, was a little bothered by that type of adjustment and wanted to see what else would be available. So in conversations with the client, we talked about different plan options. And as I mentioned earlier, you have deductibles that cover many different things. And so the deductible was $1,500. Well, when you get into $1,500, you can get into what's called the high deductible health plans, which allow us to create a health savings account, which allows employees and employers to put money into an account to save towards retirement. And in this environment, when you take the high deductible health plans, you lower the premium, and by lowering the premium, by adding the high deductible, the health savings account, you create more flexibility for the employees. And the employer liked that idea. The problem with it was we were looking at a mid-year renewal. And so it made more sense on a tax basis, and it made more sense across the board for the employer to actually make this move on January 1st of next year. And so while the employer didn't want to increase the out-of-pocket expense, they wanted to create a transitional plan. And this transitional plan would allow them to keep the out-of-pocket expense low for the employees as best we could while we wait to transition to the new plan design for a January 1 effective date. So we took that out to market. And what we were able to come up with is we're able to come up with some solutions that made sense for the employee, both transitional and for next year. And while we can't guarantee the rates for 1/1 because things change, what we found is that we could transition them into a high deductible health plan, create a health savings account, and the out-of-pocket expense to the employer would be the same. So the employer could fund part of the HSA, thus providing benefits to their employees to meet their objective of supporting the out-of-pocket expenses their employees have to face. So when we looked at the transition plan, we were able to find a plan that had a $500 deductible. We couldn't get away from that $250 deductible for the prescription drugs, and we couldn't get away from the $6,500 out-of-pocket expense. But by reducing the deductible, we were able to limit the costs. The employer was going to pay a little bit more money now, but again, in the transition period, they were willing to accept that as a way for them to begin the process of going into a plan that they hope will be more of a long-term solution to their medical plans. Thus, they were able to meet their objective of maintaining lower out-of-pocket expenses to employees at the same time as looking for a long-term solution. So the results are that starting on 1/1, we will be implementing a high deductible health plan with the health savings account. And while you may be sitting here thinking, well, I really don't understand what those are, we get that, and we understand that the client's in the same situation. Where we've built in an employee communication strategy so that during now and the beginning of the year, we're going to sit with the employees and educate them on what the new plan is going to look like, how it's going to work. So come 1/1, they have a better understanding of how this is going to be better for them than where they are now, because what they'll get with an HSA is they'll get choice of how they spend money, whether it's for medical, dental, vision, or maybe things like acupuncture, chiropractor, other types of services that they find a little bit more. The client was satisfied because while they're paying a little bit more now, we have been able to build in and address the frustration of plan designs constantly changing on them, but we can also bring in a plan design that's going to bring stability into the future for their employees, which was important to our client, and then again, to continue to build that goodwill with their employees and create retention. And so when we look at this, what we're really saying to you is, our vision of employee benefits is, it's not about how do we save money. It's really more about helping our clients understand how to maximize the investment they can afford to make in giving their employees the best benefits they can in an effort to keep them and to show gratification to them. And so our team is always here to answer questions. If you have questions about what you have, feel free to give me a call, send me an email. One of our team members is more than happy to jump on a call and talk to you, give you a second opinion of your benefits, and allow you the opportunity to make the comparisons to determine that you're actually maximizing your benefit dollars. So with that, we're right up at the deadline. Paulina, do we have any questions?
We do not have any questions in the chat.
Okay, perfect.
Anyone is welcome to unmute and ask Jim questions. If not, we'll wrap up for today.
Okay, well, thank you. Thank you, Pauline. And I hope everybody enjoys the day and has a great weekend.
Thank you, and take care.
Bye now.
Thank you so much. Bye.